All right, let's talk about anxiety. We've all been there, right? That knot in your stomach before a big presentation or a first date. But here's the big question. When does that totally normal feeling cross over into something more, something clinical? That's exactly what we're going to break down today. What anxiety is, how it's diagnosed, and how it's treated.
So, here's the plan. First, we're going to tackle the difference between just feeling anxious and having an anxiety disorder. Then, we'll get specific and look at something called GAD, or Generalized Anxiety Disorder. After that, we'll talk about what therapy is actually trying to do, and we'll wrap up by looking at the two main kinds of medication you hear about.
Okay, first things first. Let's get this straight. We throw the word anxious around all the time, but what's the real difference between that feeling we all get and a medical condition that actually needs to be treated? Let's dig in.
Yeah, nobody likes feeling anxious, right? It's uncomfortable. But believe it or not, it's there for a reason. It has a purpose. So, what is that purpose?
Well, our source material puts it this way. Anxiety is basically a survival tool. It's your brain's alarm system. When it senses danger, real or perceived, it rings that alarm to get you ready to fight, flee, or just deal with whatever's coming. It's supposed to be a temporary thing, and believe it or not, it's designed to help you.
And this is where it all becomes crystal clear. Look at the difference here. Normal anxiety, it's a temporary response to stress. It actually helps you react. It's uncomfortable, sure, but it's manageable. An anxiety disorder, on the other hand, is a whole different beast. We're talking persistent symptoms that just don't let up. It becomes so severe and excessive that it actually gets in the way of your daily life.
Okay, so now that we've got that difference down, let's zoom in a bit. There are lots of different anxiety disorders, like panic disorder or social anxiety, but today we're going to focus on one of the most common ones out there, Generalized Anxiety Disorder, or GAD for short. So what does it actually take to get a diagnosis of GAD? It's way more than just worrying a lot. There's a specific checklist. We're talking about excessive, unrealistic anxiety about a bunch of different things, and it has to be happening more days than not for at least 6 months straight. On top of that, you need at least 3 physical or psychological symptoms, and this worry can't be explained by some other illness.
And this chart, wow, it shows a really key statistic. When you look at the numbers, anxiety disorders are diagnosed in women twice as often as in men, a 2-to-1 ratio. That's a huge difference, and it's something researchers are still trying to fully understand.
All right, so someone gets diagnosed with GAD. What's the end game for treatment? What are we actually trying to achieve here? What does getting better even mean?
The whole thing is really a two-part mission. First, there's the acute goal. That's the short-term stuff. The idea is to reduce the symptoms right now and help the person get back to their normal life. But then there's the long-term goal, which is even bigger. It's about getting to a place of remission and staying there, preventing a relapse, and at the end of the day, just improving their quality of life.
So how do doctors actually do that? How do they help people reach those goals? Let's get into the nitty-gritty, starting with the first thing they usually try for long-term management.
When it comes to managing GAD for the long haul, antidepressants are considered the first line of defense. They're the go-to tool for building that long-term foundation for recovery.
But here's something that is absolutely crucial to understand. This is not a quick fix. The anti-anxiety effects don't just happen overnight. We're talking 2 to 4 weeks, sometimes even longer, before you really feel the full benefit. So patience is a huge, huge part of this.
Okay, but what about that waiting period? Or what about those moments when the anxiety is just overwhelming and you need help right now? Well, for that kind of acute relief, there's a totally different type of medication. And this table does a great job of showing how these two types of meds play on different teams. Think of antidepressants as the marathon runner. They're in it for the long haul. Benzodiazepines, though, they're the sprinters. They give you fast, rapid relief for those really intense moments. But, and this is a big but, that speed comes at a cost. There's a real risk of dependence, which is why they're usually only prescribed for a very short time, like 2 to 4 weeks.
Let's look a little closer at these benzos. They're fantastic for the physical symptoms of anxiety. The racing heart, the feeling that you can't breathe, but they're not so great for the mental side of it, like the constant worrying. And that risk of dependence we mentioned, it's a big deal. That's why doctors are so careful about prescribing them, especially if someone has a history of substance misuse.
And because of that dependence risk, stopping them isn't as simple as just not taking the next pill. It's a critical process. You absolutely have to do it with your doctor. The idea is to taper off slowly, maybe reducing the dose by about 25% a week. If someone's been on them for a long time, say a year or more, this can be a really slow process, taking 2, 3, even 4 months to do safely.
This quote from our source really says it all. Benzodiazepines give you relief from the symptoms, but they don't fix the underlying problem. They're a tool, not a cure. And that's exactly why medication is so often paired with things like psychotherapy, cognitive behavioral therapy or CBT, to actually work on the root causes.
Which brings us to probably the most important point of all. There is no magic bullet. There's no one-size-fits-all approach here. The best treatment plan is always tailored to the individual person, their symptoms, their health, and what they're comfortable with.
And so, we'll leave you with this thought. A big goal of all this is to restore overall functioning. That sounds kind of clinical, right? But it's a really personal idea. So I'll just ask you, what does that phrase mean to you? What does a full, thriving, functional life look like? Something to think about. Thanks for joining me.